Moving on to Chapter 13, Diseases of the Musculoskeletal System and Connective Tissue, M00 to M99, another one that doesn't have too many guidelines. We do have a little bit of information about site-affected and pathologic fractures and osteoporosis. So most of the sites, or most of the codes, have site and laterality designations, so that's something a little bit different than ICD-9. Again, you really need to watch your right-left bilateral versus unspecified codes. They do have some codes that indicate multiple sites for, if you had like bone, joint, muscle involvement, or you might just end up with multiple codes. It just kind of depends on what's available. If a bone is affected at the site of the joint, the site designation is still going to be of the bone rather than the joint in terms of whatever issue is going on there. And then when we code pathologic fractures, this I think is the first time really we've had to look at 7th character extensions. So let me just flip over to tabular here really quickly. I can show you what these look like. So here, notice M80, this is osteoporosis with a current pathologic fracture. This is part of our practice we're going to do. But notice the 7th character extensions. We have A for initial encounter for fracture. D is a subsequent encounter, as is G, K, and P. And their subsequent encounters either routine healing, delayed healing, non-union, or malunion. And then we have the S for sequela. So we'll take a look at this in our practice. But here, we're just indicating that initial encounter means they're undergoing active treatment. So they're having surgery to correct that fracture. It's an emergency department visit. They're just getting it evaluated and treated by a new physician, something like that. Versus a subsequent encounter, they're coming in either for problems, it could be malunion, non-union, something like that, or they're just coming in for a follow-up visit, something like that. So that's kind of your difference between an initial encounter and a subsequent encounter. Now, I've had the question posed in my classes before. A lot of times in a short diagnostic statement like those that you see in class, they might not say initial encounter in those. Well, there is no unspecified encounter option. You can see here you have to choose initial, subsequent, or sequela. Now, if you had a full chart, one would hope something in there would indicate whether this is initial or subsequent. I've kind of taken, there isn't a guideline on this, so I've kind of just adopted the stance that unless something indicates it's a subsequent encounter, I'm just assuming it's initial, and I'm going to put a letter A on it. So I don't know if that's something that will be addressed when the coding system officially comes out, or if we can just kind of safely assume it's going to be the initial encounter unless something in the record is indicating that they had been seen previously for this. There are also a few guidelines with osteoporosis. So we have categories M81 and M80. M81 is osteoporosis without a current pathologic fracture. M80 is with a current pathologic fracture. Just want to indicate here that the sites under M80 indicate the site of the fracture, not the osteoporosis. And here we essentially we assume that the fracture is being caused by the osteoporosis. If the patient had some sort of fall or trauma that a typically healthy person wouldn't end up with a fracture. So even though it's maybe not necessarily stated, if they suffer a fracture from something that somebody without osteoporosis probably wouldn't suffer a fracture from, we can go ahead and essentially code those together and say that they are related. We also have this Z87.31 personal history of osteoporosis fracture. So if a patient came in with a diagnosis, just osteoporosis, and we get the M81, we could still code the Z87.31, that personal history, if they've had fractures in the past. So a patient could have a fall, and they're coming in because they're having some pain, they evaluate it, they don't actually have a fracture, but they do have osteoporosis and they've had a fracture in the past. Again, we're just kind of painting that clearer picture that this patient is at increased risk for having a fracture, so we want to do all those extra testing and precautions. And here's our practice question for this chapter: age-related osteoporosis with pathological fracture of the tibia, initial encounter. So I thought this would be good so we can practice one of those 7th character extensions. So I'm going to flip over here to my index. So I went ahead and already found osteoporosis I'm on page 928. So osteoporosis, and then we have age-related. We do have a current pathologic fracture, and we know that that's of the tibia. So we're at that M80.06. Again, remember that dash is telling us we need some additional characters here. So I'm going to come over to my tabular. I am already on that M80 category. I'm on page 719. Then I'm going to come down to M80.06. Again, age-related osteoporosis with current pathological fracture, lower leg. So again, we had tibia. And in this case, we don't know which one. So we're going to have to use the unspecified, so M80.069, but remember we're not done yet. So very similar to fifth digits in ICD-9, you have to scroll back up and double check your category to see if you need a seventh character extension. So part of it I think is just going to be getting used to those codes that require a seventh character extension so we can remember to put those on. So we have our M80.069. Is that what we had? Sorry, I forgot. 069. Then we need to add a seventh character extension. So in this case we had initial encounter, so we're just going to add a letter A on there. So our code reads M80.069A. Again, because I already had 6 characters available, I can just attach that A on the end. If, let's say, we didn't have the 9 here, I would have to put that X in for a placeholder.